Hello, I'm Sydney Hooker, and this is my case presentation on Dr. Sachs. So, reason for referral, Dr. Sachs was referred by her general practitioner after being consulted along with a psychiatrist. The client's perception for this was, I'm not crazy or anything, I'm just kind of stuck. So she felt stuck in her day to day life. And her goal was to avoid hospitalization and also to continue her studies uninhibited by her symptoms. So upon intake, which was done by her general practitioner, Sachs stated that she lost pleasure in her usual pleasurable things, had a depressed mood, erratic eating and sleeping behavior, thoughts of worthlessness, and active suicide ideation. She, at the time, did not mention any of her schizophrenic symptoms like hallucinations or delusions, but those were being experienced as well. And then my perception initially was Dr. Sachs wants to succeed, possibly not to let her family down, but also for her own interests. So, client description. Again, Dr. Sachs is her name. I am doing this diagnostic during early adulthood, specifically during her time at Oxford. Her gender is female. Her preferred language is English. Sachs comes from a middle to high socioeconomic status, from my assumption. She's currently a graduate student at the University of Oxford. Again, these are all my current assumptions. Her monetary support is coming from her parents and also maybe a bit by her own means. She lives alone in the Oxford dorm. Her height is 5'10". Specifically at age 12, I believe she could have grown taller, but that is the height that I have recorded. And her weight has varied, but is usually considered underweight. Like at age 12, she was 100, which is severely underweight. She has an unmanaged physical appearance during this time, really erratic, really unclean, not a lot of self-care occurring just due to the symptoms she's experiencing. And then during her mental state exam, there was presence of depressive symptoms, periods of dissociation, catatonic behavior, and then self-soothing behaviors like rocking. So life history, again, the first early symptoms of schizophrenia that Dr. Sachs has experienced occurred at age 8 with hallucinations, specifically with a man outside her bedroom window. At the same period of time, catatonic behavior, specifically akinetic catatonia, was occurring, where she was non-responsive for hours, or she was basically, as she stated, her consciousness gradually was losing its coherence, and she was completely losing herself, which is not a fun experience for around that time period. She also had periods of disordered eating, which potentially could get diagnosed as a eating disorder due to her BMI being extremely low, as I mentioned earlier, being 5'10" and 100 pounds. So yeah, that is her general life history in terms of that. She lives with 2 parents, a mom and a dad, and I believe she has a brother. There is no mention of previous mental health history or any familial conflicts or divorces or any aspects like that. There is some strictness mentioned with food and discussion of calories and other aspects like that, as well as general responses to substances like weed, and just general fear for that kind of action. So with past history of treatment, again, with drug use, Dr. Sachs had done weed once and she told her parents, and they sent her to Operation Reentry. So not the greatest response from them. This kind of predisposed her to being very avoidant of any drugs in terms of treatment. She also went to therapy for 3 appointments. It wasn't very good, kind of childish. Not her, but the therapist. She went to a cardiologist for panic attacks, so she did not know they were panic attacks at the time and was prescribed Inderal, a beta blocker. She went to a neurologist who recommended that she see a psychiatrist, and then the general practitioner recommended for her to get hospitalized and see a psychiatrist there. So, clinical base formulation. So we're going to go over the biopsychosocial and spiritual aspects of this clinical case. So biologically, she has neurodysfunction evidenced by symptomatology beginning at age 8 and becoming significantly more acute at intake. This is just, you can see by the general imbalances with dopamine and potentially serotonin So yeah, and then with Psycho, she has maladaptive patterns of thinking, potentially cannot fail or her parents will no longer love her. This is a hypothesis. And then current psychotic and depressive symptoms, which I mentioned earlier. Socially, a pattern of parenting that resulted in potential toxic childhood stress. Again, another hypothesis. And then spiritually, she has a sense that she is somehow evil. This is seen through her delusions, although she is not particularly religious. With my DSM-5 diagnosis, I'm aiming to diagnose Dr. Sachs with schizoaffective disorder with depressive presentation. Firstly, I'm going to focus on the schizophrenia spectrum area. So again, she has experienced hallucinations. She also experiences religious and nihilistic delusions. She has two symptoms from criteria A, which generally demonstrates that they are on the schizophrenia spectrum. She also has been socially withdrawn and had catatonic behaviors. So that's why I would diagnose Dr. Sachs on the schizophrenic spectrum. As we move on to the depressive type aspect, again, at her intake, Dr. Sachs said she had depressed mood, erratic eating and sleeping behavior, thoughts of worthlessness, and overactive ideation. This seemingly has gone for a period of over 2 weeks, and she has received an SSRI for it that seemingly had a noticeable effect on her, which further strengthens this potential diagnosis. So, with the combination of these two thoughts, I've decided to diagnose Dr. Sachs with depressive type schizoaffective disorder, which is demonstrated by the presence of both schizophrenic and depressive symptoms. So, with treatment, I would recommend cognitive behavioral approach for Dr. Sachs, with treating in a combination with medication as well. Cognitive behavioral therapy with depression is the most effective, with also pharmacotherapy combined with it. I would recommend both an antidepressant and an antipsychotic to get both of the symptoms. So I believe cognitive behavioral therapy can help the client to discern reality from fantasy in combination with an antipsychotic. So that is what I think would be best for her schizophrenia. And I hope that the CBT would help establish methods of upkeep for this client to help with her incomplete remission, because she is going to be struggling with this for a lot of her life. And her main goals here are to continue with school and not to be inhibited in her day-to-day life. So creating ways in which she can discern reality from fantasy herself and also build up other potentialities of how to manage this will really help her with moving on and becoming more independent moving forward. So I have a couple of clinical concerns, mainly with the family. I'm curious, schizophrenia has a really strong genetic component, so I'm really curious about the family's history with mental illness or schizophrenia or even depression. I'm very curious to see if there's any genetics involved with the onset and the appearance of her symptoms. I would also like to know more about the Sachs parents. I kind of want to know more about their parenting style and if it truly, as I hypothesized, potentially hurt her or how it helped her. I also am really curious on why psychodynamic therapy seemed to help Dr. Sachs. Dr. Sachs, I guess, is a philosophy major, so there is that aspect, but I feel like it would cause her to present a lot of her delusions and to directly address a lot of her delusions, which would make it even harder to discern reality from fiction. So overall, I am diagnosing Dr. Sachs with depressive type schizoaffective disorder, which is different from her official schizophrenia diagnosis, but I hope this has been a good representation of a clinical presentation. Thank you very much.